Welcome to the grand finale of our Top 200 Drug Challenge. We have officially made it to Part 4. If you've been with us since the beginning, you've already mastered 150 medications, which is a massive achievement. If you're just joining us for this final leg, make sure to check out the previous 3 parts to ensure you've covered the entire list. This series is designed to turn those boring flashcards into a gamified challenge to help you ace your certification. Just like before, I'll provide 3 detailed clinical clues followed by a 5-second timer for you to guess the name. Some answers will be the brand and some will be the generic. Remember, if the clues are a bit tricky, don't hesitate to pause the video. Let's bring it home with drug number 151. This is PTCB Prep Guide. Starting our final batch, we have a heavy hitter in the HMG-CoA reductase inhibitor class. This medication carries a very specific warning that patients should avoid consuming grapefruit or its juice, as it can lead to toxic levels in the blood. Most importantly, patients must report any unexplained muscle pain or weakness immediately to avoid a serious condition called rhabdomyolysis. Can you identify this brand name? The name you're looking for is Lipitor. The generic name for this medication is atorvastatin, and it stands as one of the most frequently dispensed high-intensity statins in the world. When you are fulfilling this prescription, always ensure the Avoid Grapefruit auxiliary label is fixed to the bottle to prevent dangerous drug-food interactions. Moving to 152, we find a medication for type 2 diabetes that belongs to the sulfonylurea class. It works by causing the pancreas to release more of its own insulin throughout the day. Because it is so effective at lowering blood sugar, it carries a high risk of hypoglycemia, and we usually instruct patients to take it with their first main meal, typically breakfast. Do you know this generic name? That would be glimepiride. Sold under the brand name Amrol, this drug is often avoided in elderly patients due to the long-lasting risk of low blood sugar. As a technician, it is vital to remind patients to always have a quick source of sugar, such as glucose tablets, on hand in case their levels drop too low during the day. For 153, we have a medication used to manage the symptoms of Alzheimer's disease. It belongs to the cholinesterase inhibitor class and works by preventing the breakdown of a chemical messenger in the brain involved in memory. Because it is known for causing significant nausea or very vivid dreams, it is almost always taken right before bed. See if you can name this brand. This one is known as Aricept. While this medication, known generically as donepezil, manages the symptoms of memory loss, it is important to clarify to families that it does not cure the underlying disease. It is a staple in memory care and is frequently prescribed in higher strengths as the patient's condition progresses over time. Next, for 154, let's look at a medication that is arguably the most common non-aspirin analgesic and fever reducer found in the pharmacy. While it is very safe at normal doses, it carries a strict maximum limit of 4 grams per day for adults. Exceeding this limit can lead to severe hepatotoxicity, which is permanent liver damage. What is the generic name for this staple? Essentially, we're talking about acetaminophen. Widely recognized as Tylenol and abbreviated as APAP, this ingredient is hidden in hundreds of combination products like Percocet and Vicodin, making technician vigilance during drug utilization reviews essential. You should also note that the maximum daily limit is often lower for patients with existing liver issues or those who consume alcohol regularly. Number 155 is a high-alert medication used to treat life-threatening heart rhythm disorders called arrhythmias. It stays in the body for a very long time, sometimes months, and can affect the lungs, liver, and thyroid. Because of this, patients need regular blood tests and even eye exams to monitor for toxicity. Do you recognize this brand name? The label on this one reads Cortisone. Known generically as amiodarone, this potent medication is often dispensed in light-resistant amber vials to protect its chemical stability. Patients should be warned that it can cause the skin to take on a strange bluish-gray tint if they are exposed to too much sun without protection. Moving on to 156, we have an atypical antipsychotic used for schizophrenia and bipolar disorder. A very specific dispensing instruction for this drug is that it must be taken with a meal of at least 500 calories to ensure the body absorbs it correctly. It also carries a clinical risk of a heart rhythm issue called QT prolongation. What generic name are we looking for? In a nutshell, it's ziprasidone, sold as the brand Geodon. This medication requires a take with food auxiliary label because taking it on an empty stomach can cut the effective dose in half. In some hospital settings, you may also see this available as an intramuscular injection for treating acute agitation. For 157, we have an SSRI antidepressant used for major depression and various anxiety disorders. This specific drug is well known for having a very short half-life, meaning the body clears it quickly. This means missing just 1 or 2 doses can lead to uncomfortable brain zaps or dizziness. Name this brand for me. The brand in question is Paxil. The generic version is paroxetine, and because it can be quite sedating, many patients find it best to take their dose in the evening. It is also worth noting that this specific SSRI carries a higher risk during pregnancy and is typically avoided for expectant mothers compared to other drugs in its class. At number 158, let's look at an NSAID used to treat the pain and inflammation of arthritis. Unlike many other drugs in its class that require 3 or 4 doses a day, this one has a very long duration and is typically taken just once every 24 hours. Like all drugs in its class, it must be taken with food to protect the stomach lining. Can you identify this generic? The short version is oxaprozin. This drug is known by the brand Daypro and is an excellent option for patients struggling with pill fatigue since it only requires 1 dose daily. Technicians should always check for a history of stomach ulcers or the use of blood thinners like warfarin, as this combination can significantly increase the risk of internal bleeding. Next, for 159, we have an anticholinergic medication used to treat tremors caused by Parkinson's or certain psychiatric drugs. It helps restore the balance of chemicals in the brain to reduce muscle stiffness and shaking. It frequently causes drying side effects like dry mouth, blurred vision, and constipation. Which brand is this? You're looking for cogentine. Known generically as benztropine, this drug is frequently used to counteract the extrapyramidal side effects of antipsychotic medications. Advise your patients to stay well hydrated and use sugarless gum for dry mouth, and warn them to be careful in hot weather since the drug can decrease the body's ability to sweat. Rounding out our 10th drug of this final batch at 160, we have a long-acting beta blocker that is a standard treatment for heart failure. It is designed to be taken once daily to provide a steady release of medication over 24 hours. A critical safety rule is that the patient should never stop taking it abruptly. Guess this generic name. To put it simply, it's metoprolol succinate. The brand name is Toprol XL, and it is crucial that you never confuse this with metoprolol tartrate, which is the short-acting version. The suffix succinate serves as your primary indicator that the drug is designed for extended release to provide a full day of heart rate control. You are doing incredible. We have reached 160 drugs, which means we are only 40 medications away from finishing the entire top 200 list. If you are feeling like a pharmacy pro right now, hit that subscribe button and tap the like button to help the channel out. All right, let's head into the home stretch with number 161. Moving into 161, we have a very potent statin used to lower high cholesterol and protect the heart. It is considered one of the most effective drugs in its class and can be taken at any time of day, with or without food. Like all statins, it is strictly contraindicated during pregnancy. Identify this brand name. The correct identification is Crestor. The generic name is rosuvastatin, and it is often the preferred choice for doctors when a patient requires a massive reduction in their LDL cholesterol levels. Be aware that lower starting doses are often used for patients of Asian descent due to a known increase in sensitivity to this specific medication. Next, for 162, we find an NSAID that is unique because it is available in tablets, a topical gel, and even a skin patch. It is used to treat pain and inflammation from conditions like osteoarthritis. When dispensing the oral form, technicians should note that it carries a risk of serious cardiovascular events. What brand is this? The answer key says Voltaren. This medication is generic diclofenac, and while the gel version is now available over the counter, the oral tablets still require a prescription. If you are dispensing the gel, always include the clear plastic dosing card so the patient knows exactly how much to apply to their joints for effective relief. Number 163 brings us to a non-stimulant medication used for ADHD. It belongs to the SNRI class and works by increasing the levels of norepinephrine in the brain. Because it is not a controlled substance, it is a common alternative for patients who cannot take stimulants. Do you know the brand name? This one goes by Strattera. Known generically as atomoxetine, this medication does not provide immediate results and can take several weeks of daily use before a change in focus is noticed. It is important to monitor pediatric patients for side effects like nausea and decreased appetite, as these can affect growth and development over time. Moving on to 164, we have a member of the B vitamin family that is essential for producing healthy red blood cells. It is a critical supplement for women who are pregnant to prevent certain birth defects of the brain and spine. It is also used to treat certain types of anemia. What generic are we talking about? We are referring to folic acid, also known as vitamin B9. This supplement is frequently dispensed in the pharmacy at a prescription strength of 1 milligram. Beyond pregnancy, it is also essential for patients taking medications like methotrexate, which can deplete the body's natural stores and lead to toxicity if not replaced. For 165, we have a Schedule 4 benzodiazepine that is very commonly used for the short-term relief of intense anxiety. It is also used in the hospital as an injection to stop a continuous seizure. Because it is highly sedating and can be habit-forming, it is strictly regulated as a controlled substance. Which brand is this? The clinical name for this brand is Ativan. This drug is generically known as lorazepam, and as a C4 controlled substance, the prescription expires exactly 6 months from the date it was written. It is imperative to warn patients never to mix this with alcohol, as the combination can lead to fatal respiratory depression and severe confusion. Next, for 166, we have a heart medication that belongs to the angiotensin receptor blocker class. It is used for high blood pressure and to protect the kidneys in patients with diabetes. It carries a boxed warning that it should be discontinued immediately if the patient becomes pregnant. Guess this brand name. Based on those clues, it's Cozar. Known generically as losartan, this medication is much less likely than ACE inhibitors to cause the persistent dry cough that many patients find unbearable. Technicians should keep an eye out for interactions with potassium-sparing diuretics, as combining them can lead to dangerously elevated potassium levels in the blood. At number 167, we have a hormone replacement therapy used to treat the symptoms of menopause, such as hot flashes. It is available as a tablet, a cream, and even a vaginal ring. Like all estrogen products, it carries an increased risk of blood clots and stroke. Do you recognize this brand? The brand you're thinking of is Estress. The generic version is estradiol, and patients should be counseled to take their dose at the exact same time every day to maintain steady hormone levels. You should also warn patients that smoking while using this therapy significantly increases the risk of serious cardiovascular events like blood clots and stroke. Moving to 168, we find a common antiviral used to treat infections caused by herpes viruses, including chickenpox and shingles. It works by stopping the virus from multiplying, but it does not actually cure the virus. It should be started at the very first sign of a flare-up for the best results. Identify this brand. This particular brand is Zovirax. Generically known as acyclovir, this antiviral requires the patient to drink plenty of fluids to prevent the medication from forming crystals in the kidneys. It comes in many forms, and if you are dispensing the topical ointment, remind the patient to use a glove or applicator to prevent spreading the virus to other parts of the body. For 169, we have a medication used to treat an enlarged prostate by shrinking the gland over time. It works by blocking a specific hormone that causes prostate growth. A vital safety rule is that pregnant women should never even touch a crushed or broken tablet of this medicine. Which brand name is it? The pharmacy lists this as Proscar. The generic name is finasteride, and you might also see the 1 milligram version dispensed under the brand name Propecia for male pattern baldness. Patients should be informed that it can take up to 6 months of consistent use before they notice a significant reduction in their urinary symptoms. We've hit 170. This is an atypical antipsychotic used for schizophrenia and bipolar disorder. It is unique because it is often described as a dopamine stabilizer rather than a total blocker. Technicians should monitor for a side effect called akathisia, where the patient feels an uncontrollable urge to move. Can you name the brand? The solution is Abilify, known generically as aripiprazole. This drug is frequently used as an adjunctive or add-on treatment for adults whose depression isn't fully responding to standard antidepressants. It is also available as a long-acting injectable, which can be a convenient option for patients who struggle with daily pill adherence. Moving into 171, we have an antiviral medication used specifically to treat and prevent the flu. To be most effective, it needs to be started within 48 hours of the patient first feeling sick. It works by preventing the flu virus from spreading throughout the body. Name this brand. It looks like you're looking for Tamiflu. This medication, generic oseltamivir, sees a massive spike in use during the winter months, especially in its liquid suspension form for children. The suspension must be shaken thoroughly before each dose and is often stored in the refrigerator to maintain its stability and improve the taste for young patients. Next, for 172, we have a cholesterol medication that works by preventing the body from absorbing cholesterol from the food we eat in the small intestine. It is not a statin, so it does not carry the same risk of muscle pain. It is often used alongside a statin to help get a patient's numbers down. Guess the brand. The name on the bottle is Zetia. Generically known as ezetimibe, this is a small, once-daily tablet that is usually very well tolerated by patients who cannot take statins due to muscle pain. It is frequently combined with simvastatin in a single pill known as Vytorin to provide two different pathways for lowering cholesterol levels. Rounding out this set at 173, we have an injectable anticoagulant used to prevent and treat deep vein thrombosis. It is a low molecular weight heparin that is injected into the fatty tissue of the abdomen. It is often used after surgery or during long hospital stays. What generic is this? This generic is enoxaparin. Sold under the brand name Lovenox, this injectable requires patients to rotate their injection sites across the abdomen to avoid tissue damage. Unlike warfarin, it does not require constant blood monitoring, but patients should be cautioned not to rub the injection site afterward to minimize the risk of large bruises. Now for 174, we have a combination inhaler used for the long-term management of asthma and COPD. It contains two ingredients, a corticosteroid for inflammation and a long-acting bronchodilator. Patients must be reminded to rinse their mouth after every use to prevent a fungal infection called thrush. Do you recognize the brand? This combo is branded as Advair. This is a combination of fluticasone and salmeterol, most commonly seen in the purple discus device, which delivers a dry powder for inhalation. It is critical to remind patients that this is a maintenance medication and will not work as a rescue inhaler during an active asthma attack or shortness of breath. Number 175 is a Schedule IV hypnotic used for the short-term treatment of insomnia. It is well known for causing unusual sleep behaviors such as eating or even driving while the patient is still asleep. It works by slowing down activity in the brain to allow for sleep. Name this brand for me. This is commonly known as Ambien. The generic name is Zolpidem, and patients should be strictly advised to take it only when they are ready for bed and have a full 7 to 8 hours to dedicate to sleep. Interestingly, women are often prescribed a lower starting dose because their bodies clear the medication from the bloodstream more slowly than men. For 176, we have a vaccine used to prevent shingles in adults over the age of 50. It is a recombinant vaccine that is given in 2 separate doses, usually 2 to 6 months apart. A key storage point for technicians is that it must be kept in the refrigerator, never the freezer. Identify this brand. The answer is Shingrix. Given as an intramuscular injection, this vaccine is incredibly effective at preventing shingles and the long-term nerve pain that often follows. You should warn patients that it is very common to experience a sore arm, redness, and even a mild fever or fatigue for a day or two after receiving the shot. Moving to 177, we have a very common NSAID used for minor aches, pains, and fever. It is one of the most widely used over-the-counter medications in the world and is found in almost every medicine cabinet. Patients should be warned not to take it with other NSAIDs like naproxen or aspirin. What brand name is this? Most people know this as Advil or Motrin. Generically known as ibuprofen, this staple medication should always be taken with food or milk to prevent stomach irritation. Technicians should stay alert for patients on blood thinners who are purchasing this over the counter, as the combination can significantly increase their risk of internal bleeding. For 178, we have a famous first-generation antihistamine. While it is great for treating allergy symptoms and hives, it is very sedating and is often found as the main ingredient in nighttime sleep aids. It is also used to treat motion sickness. Which generic is this? That would be diphenhydramine, known by the brand name Benadryl. This medication can sometimes cause a paradoxical effect in children, making them hyperactive instead of sleepy. In the elderly, it is often avoided because its anticholinergic properties can lead to confusion, dizziness, and a much higher risk of falling. Next, for 179, we have a rapid-acting insulin used by diabetics to cover the rise in blood sugar that happens after eating. It is usually injected about 15 minutes before the first bite of a meal. It is a clear liquid and works very quickly. Name the brand. The one we're looking for is Humalog. Known generically as insulin Lispro, this rapid-acting medication requires the patient to have the correct supplies, such as pen needles or U100 syringes, ready for use. Once a vial or pen is opened, it can typically be kept at room temperature for up to 28 days, making it more convenient for patients on the go. At 180, we have a vasodilator used to treat high blood pressure. A unique side effect of this drug is that it can cause a, quote, lupus-like syndrome, which includes joint pain and a butterfly rash. Because it can cause a fast heart rate, it is often prescribed with a beta blocker. Do you know this brand? This medication is apresoline. The generic version is hydralazine, and it works by relaxing and dilating the blood vessels to allow blood to flow more easily. It is usually taken multiple times a day with meals, and patients should be warned to stand up slowly to avoid the dizziness associated with a sudden drop in blood pressure. Number 181 is an ACE inhibitor used for hypertension. Like all drugs in this class, it can cause a persistent dry cough and carries a risk of high potassium levels. It also has a boxed warning regarding risks to the fetus during pregnancy. Which brand name are we looking for? The prescription name is Lotensin. The generic name is benazepril, and like all ACE inhibitors, it ends in the suffix pril. Technicians should be aware of the rare but serious side effect called angioedema, which involves life-threatening swelling of the face, lips, and tongue that requires immediate medical attention. Moving on to 182, we have an angiotensin receptor blocker used for high blood pressure. It is often prescribed for patients who had to stop taking an ACE inhibitor because of that annoying dry cough. It helps keep the blood vessels open to lower pressure. Identify this brand. This is marketed as Avapro. Generically known as irbesartan, this medication is a once-daily tablet that provides consistent blood pressure control for a full 24 hours. As part of the ARB class, you can identify it and similar drugs by the sartan suffix at the end of the generic name. For 183, we have a common penicillin-type antibiotic that is actually a combination of two drugs. It is used for more difficult infections like sinus or ear infections. It is notorious for causing an upset stomach and diarrhea if not taken correctly. Can you name the brand? That's going to be Augmentin. This is a combination of amoxicillin and clavulanate, where the second ingredient helps prevent bacteria from destroying the antibiotic. To minimize the frequent side effect of diarrhea, technicians should remind patients to take this medication with a full meal, rather than on an empty stomach. At 184, we have an NSAID that is unique because it is a COX-2 inhibitor. It is used for arthritis and acute pain and was designed to be easier on the stomach than older drugs like ibuprofen. A key dispensing check is to verify if the patient has a sulfa allergy. What is the brand name? The brand name is Celebrex. Known generically as celecoxib, this medication is the only COX-2 inhibitor currently available in the U.S. and was designed specifically to reduce GI irritation. However, it still carries a boxed warning regarding the increased risk of cardiovascular events like heart attack or stroke, just like other NSAIDs. Next, for 185, is a proton pump inhibitor used for acid reflux and stomach ulcers. It works by shutting down the acid pumps in the stomach lining to allow the esophagus to heal. It is most effective when taken once daily before the first meal. Which brand name is it? You're after Acifex. The generic name is Rabeprazole, and like others in the PPI class, it should be taken 30 to 60 minutes before eating the first meal of the day. Long-term use of these medications can sometimes lead to low magnesium levels or an increased risk of bone fractures, so they are generally used at the lowest effective dose. Number 186 is a dopamine agonist used to treat Parkinson's disease and restless leg syndrome. It can cause sudden sleep attacks where the patient falls asleep without any warning, making driving dangerous. Guess this brand name. The answer is Requip. Generically known as ropinirole, this medication carries a strong look-alike, sound-alike warning to ensure it isn't confused with the antipsychotic Risperdal. Patients should also be monitored for new or increased compulsive behaviors, such as an uncontrollable urge to gamble or binge eat while taking this drug. Next, for 187, we have a corticosteroid that is often used for severe inflammation or allergic reactions. It is most famous for its 6-day dose pack, which tells the patient exactly how many pills to take each day as the dose tapers down. Identify this brand. This is known as Medrol. The generic version is methylprednisolone, and it is vital that technicians emphasize the importance of following the pack's instructions exactly to allow the body's natural steroid production to resume safely. Always remind patients to take these tablets with food to avoid significant stomach irritation and upset. For 188, we have a unique medication used for asthma and allergies that belongs to the leukotriene modifier class. It is not a steroid and is taken as a tablet once daily in the evening. It helps prevent the swelling in the airways that causes asthma symptoms. Do you know this brand? The brand is Singulair. Known generically as Montelukast, this medication carries a prominent boxed warning regarding serious changes in mood and behavior, which should be monitored closely by families. It is a popular non-steroidal option for preventing asthma attacks and is particularly effective for symptoms triggered by exercise. Question 189 is a third-generation cephalosporin antibiotic used for serious infections. In the clinic, it is very common as a one-time injection for certain sexually transmitted diseases. It is a very broad-spectrum antibiotic. Which brand are we looking for? That would be Rocephin. Known generically as ceftriaxone, this powerful antibiotic is usually kept as a dry powder in the pharmacy and must be reconstituted with a liquid like lidocaine to make the injection less painful. In a hospital setting, it is a first-line treatment for severe infections like pneumonia or complicated urinary tract infections. Moving on to 190, we have the #1 first-line medication for type 2 diabetes. It belongs to the biguanide class and must be taken with meals to reduce the risk of severe GI upset. It helps the body respond better to its own insulin. Name the brand. The answer key lists glucophage. This is generic metformin, and it is critical for technicians to monitor for drug utilization alerts regarding the patient's kidney function before dispensing it. Patients should also be advised to temporarily stop taking this medication for 48 hours before any medical imaging that requires the use of IV contrast dye. Number 191 is a popular antibiotic, often taken as a short 5-day course. It is frequently referred to as a Z-Pack and is a great option for patients who are allergic to penicillin. It stays in the tissues to fight infection long after the last pill is taken. Guess the brand. You've guessed it, Zithromax. Known generically as azithromycin, the standard Z-Pack involves taking 2 tablets on the first day followed by 1 tablet for the next 4 days. Because of its long half-life, the medication continues to work in the body for up to 10 days after the final dose has been consumed by the patient. At 192, we have a medication that belongs to the triptan class and is used for the acute treatment of migraine headaches. It works by narrowing the blood vessels around the brain. It is available as a tablet and as a nasal spray for those who are vomiting. Identify this brand. This one is Zomig. The generic version is zolmitriptan, and like all triptans, it should be administered as soon as the patient feels a migraine headache beginning. It is strictly contraindicated in patients with a history of certain heart conditions or uncontrolled high blood pressure due to its effect on the blood vessels. We are almost to the end. Number 193 is an anticoagulant used to prevent strokes and blood clots. It is a factor Xa inhibitor that is taken twice daily. Unlike older blood thinners, it does not require regular blood monitoring or dietary restrictions. What brand is this? The brand in question is Eliquis, generically known as apixaban. This medication is often preferred by doctors because it carries a lower risk of major bleeding compared to warfarin. Technicians must emphasize the importance of dose consistency, as missing even 1 dose can significantly increase the risk of a life-threatening blood clot. Number 194 is a medication for type 2 diabetes that helps the body use its own insulin more effectively. It belongs to the TZD class and carries a boxed warning about the risk of congestive heart failure. Do you know this generic name? Essentially, we're talking about pioglitazone. The brand name for this drug is Actos, and patients should be strictly counseled to report any sudden weight gain or swelling in their ankles, which can be signs of fluid buildup. In addition to the heart failure risk, some studies have also linked the long-term use of this medication to an increased risk of bone fractures. At 195, we have a beta blocker used for hypertension and heart protection. It is cardioselective, meaning it mainly targets the heart and is less likely to affect the lungs than older beta blockers. It helps slow down the heart rate. Which brand name is it? The name on the prescription is Tenormin. The generic version is atenolol, and patients must be warned never to stop taking this medication abruptly, as doing so can cause a dangerous rebound spike in blood pressure. Beyond hypertension, it is frequently used to prevent migraines and to manage chronic chest pain, known as angina. For 196, we have an electrolyte supplement used for patients with low potassium. It is often paired with diuretics like Lasix that cause the body to lose this vital mineral. It is a very large pill and should be taken with plenty of water. Guess this brand name? The answer is Chlorcon. This is generic potassium chloride, and because the tablets can be quite large and irritating to the throat, they should always be taken with a full glass of water and a large meal. Technicians should remind patients that these pills must be swallowed whole and never crushed, chewed, or broken, as they are designed for slow release. Next, for 197, we have an antibiotic that is famous for its dangerous interaction with alcohol. Patients must avoid all alcohol during treatment and for 3 full days after the last dose to avoid violent vomiting. It is used for GI and vaginal infections. Identify the brand name. This is the well-known Flagyl. Known generically as metronidazole, this medication can cause a strange metallic taste in the mouth and may turn the patient's urine a dark reddish-brown color. It is a versatile drug that is effective against both anaerobic bacteria and certain parasites, making it a staple for treating various internal infections. For 198, we have a Schedule II stimulant used for the treatment of ADHD. It is the more potent D-isomer of the active ingredient in Ritalin. It works by increasing focus and decreasing impulsivity. What is the generic name? That would be dexmethylphenidate. Sold under the brand name Focalin, this C2-controlled substance requires a valid original prescription and cannot be refilled under any circumstances. It is available in both immediate release and extended release versions, and technicians should always verify the exact formulation the doctor has requested before dispensing. We are down to the final 2. Number 199 is a statin used for high cholesterol. It is one of the older medications in its class and is most effective when taken in the evening before bed. It helps lower LDL and raise HDL. Do you recognize this brand? To put it simply, it's Zocor. The generic name is simvastatin, and because of its higher risk for muscle damage, the 80 mg strength is very rarely used in new patients today. It has a significant number of drug-drug interactions, particularly with certain blood pressure medications and antifungals, so technicians should always run a thorough interaction check. And finally, number 200. This is a powerful medication used for rheumatoid arthritis and certain types of cancer. It works by interfering with the growth of certain cells. It is uniquely taken only once a week for arthritis. Which brand name is this? The final answer is Trexall. Generically known as methotrexate, this medication is highly effective but extremely dangerous if not taken correctly. Technicians must verify that the patient understands the weekly dosing schedule. Taking this drug every day by mistake can lead to fatal bone marrow suppression, so many patients are also prescribed a folic acid supplement to help protect their healthy cells. Congratulations! You have officially completed the Top 200 Drug Challenge. You have navigated all 4 parts and mastered the most important medications in the pharmacy. You are now more prepared than ever for your certification exam. Thank you so much for studying with us, and good luck. We know you're going to crush it. Also, check out our other videos. To do that, click that channel logo in the middle of the screen to subscribe. Click on the cards to choose your next watch. Thank you again for watching, and good luck.